is Tim Reha, host of Digital Health Live at CES 2015. Super excited to have Amy O'Connor with Everyday Health. How are you doing?
Hey Tim, how are you?
So I remember having Michael on the show here. What's your personal background? Let's start there.
Sure. I've been a health editor for over 20 years, and I'm very excited to be at Everyday Health. It's the leading health and wellness digital site, and we are covering. We're here at CES to cover some of the cool new technology for consumers, because we're all about helping consumers live happier, healthier lives.
Yeah, we're having some really cool conversations about empowering consumers, and now with a lot of these new tools, especially the next wave of stuff that's coming up, is I got to take control of myself. Especially, I just turned 40-something, and
Yeah, well, the problem with having any sort of condition is that you want to go see your doctor, but your doctor isn't available, or he's got 15 minutes for you. Consumers more and more, they know more, and they want to take charge of their health. And what's amazing here at CES is seeing the way that technology is helping consumers take control of their health. We've seen some amazing technology from, I don't know, have you ever heard of a colonoscopy? That's what you're going to have when you're over 50. It's like a very unpleasant procedure, but now technology is allowing you to actually do that at home and send the matter out to a lab, and it's all very digital. And then what's also really interesting is technology that's not so high tech. We saw a wonderful device. It's a shoe that you can put on without bending over. So people that have disability or movement disorders or just issues around dexterity, they can put their shoes on without actually having to bend over and do the hard work of tying their laces.
yeah, it's I don't want to say crazy. It's amazing the innovation that's happening here, and you just see it walking by getting a coffee. I just turned 44, just had a birthday. I bonked my head, and I was actually, I got to look out for new things, and I go to your guys' site in because it shows up in the search results. How big is the network?
Everyday Health is a lot bigger than a lot of people realize. We reach 48 million consumers and healthcare professionals and doctors. And the great thing about Everyday Health is, there's other sites where you go if you're sick or if you're not feeling well, you get an answer. We do that too. But we're all about helping you manage your health every single day and giving you actionable advice. As a journalist, I really hate it when a website tells me to go see my doctor, because one of the reasons I'm on your site is because I don't want to see my doctor, right? I want to get as many answers as possible.
Or I even went and saw my doctor, and they're like, "Oh, it looks like you're having a heart attack," and then they just want to give me the pills. But I'm like, no, I want data on that. So then I was going to your guys' site and say, okay, I need to know more, and they didn't really give me anything.
You need to know more, and you also, I think that one of the great things about our site is that we give you a bunch of different opinions, so you make your own choices. We've got experts on the site like Dr. Sanjay Gupta and Heidi Murkoff, who's the author of What to Expect When You're Expecting. She's also WhatToExpect.com's contributor. And so you get, not only do you get encyclopedic information, you get voices and opinions with a point of view, and also you get patient experiences, because I think that's also missing. You don't want to just hear from the doctor in a white coat. You want to know what happened to a patient who's been through what you might be going through and who's made those decisions. One of our franchises that does really well is 10 things your doctor won't tell you about blank. Now, we're not slamming doctors because they know a lot, but they're not always going to tell you what you should be eating or what you do when you go on vacation with a condition, because there's a lot of information out there that you don't get elsewhere.
Yeah, there's a lot of I don't want to say hacks, but there's a lot of like special things that people will do to resolve, pain, or I might use an ice cube in this, or have a heat pack.
Say hacks because, sometimes, you certainly don't want to hack your prescription medication, but you might want to do things a little bit differently because you are a person who is sensitive to certain kinds of medication, or you are a vegetarian, and so a diabetic diet that's for one person isn't going to be for you, right? So we try and give that information, very personalized, customized health information to help people make decisions.
So you're out here also looking at innovation. You've been in this business a long time, so you've developed a really refined filter. What gets through your filter and really jazzes you up?
I'll tell you what doesn't get through my filter is technology for technology's sake. I mean, I'm not as much of a, there's a lot of geeks around here, and I say that with a lot of respect, but I don't like technology that doesn't help consumers take charge of their lives. And what we're seeing here at CES this year is so much technology that really brings it down to the level of helping people, and that's what's been exciting.
So the technology becomes invisible, and it's more or less a result.
Yeah, and it's really easy to use because if you're a person that suffers from a chronic condition, learning some new app that's really complicated or requires training, it's just not going to happen. You get one chance with these consumers, and I really see innovators doing a lot of work helping consumers take action with technology.
So if I were to partner with Everyday Health and do some business development, or how can you help companies here?
There's so much we can do. We can, editorially, I could help cover them. We also have a tech blog, a tech health blog, which is really amazing for getting the message out there. And then there's all sorts of ways. We are a portfolio of sites, so we're always open to partnership opportunities with other innovators that are helping consumers live healthier lives.
What's next for you? And what's cool is we're working on the Everyday Health Awards here, which has been really cool. I'm an entrepreneur, and that creates a platform to highlight great innovations on a global scale. Let's talk about the Everyday Health Awards.
Sure. So the Everyday Health Awards for Innovation recognized innovations in the areas of consumer health and pharmaceuticals, and also pet health, which was actually my contribution. I thought that would be sort of interesting, right?
I totally agree. I mean, like, everything's about human-centric. It's like, look, there's a lot of other animals on the planet, and is there like the last black rhino sensor and stuff like that?
It's amazing because we know a lot about our consumers, and we know that they are, we call them the chief health officer. So they take care of themselves. They usually take care of their spouses or partners. They probably got kids that are driving them crazy that they're taking care of, but they're also taking care of their pets. And 90% of our audience actually has a pet. So I think that taking care of your pet's health is an important emerging field.
Yeah, I saw some cool dog sensors and location devices. And what's interesting is pets also take drugs.
Pets take drugs, and they also, I saw a sensor that, if you leave your pet in the car, you can find out what their environment is like so they don't get too hot, and, it's great stuff.
So how many companies do you know about how many companies applied for the awards, and what type of companies were we looking for this year for the awards?
We had many applications, and we narrowed it down to, I don't know, actually. I'm sorry, I had to come back.
Now, there was a lot, and I met a couple of the panelists, which was cool about the awards program is we had venture capitalists basically looking at the deal flow, and there's nothing better to have a VC looking at your deal flow, especially tied to this event, so they can help you out. We did the awards last year, and what we're going to do is basically we'll create an expose, and you can go to the website and see all the winners. But let's go back to why you guys are doing the award.
We're doing the awards because we are a digital health company, but we wanted to recognize innovations in consumer health, companies that are really helping people live healthier lives and helping healthcare providers make life easier for their patients.
Are you guys doing editorial on the winners?
We are absolutely covering this whole event, and we're blogging it, and we've got it up on social, and we covered the awards as well.
Okay. Any last things you want to cover here?
We good? Yeah.
All right. So let's wrap there. Amy O'Connor, great to have you again back at our event here and sponsoring the Everyday Health Awards, and we'll go get a glass of wine at the end of the show.
All right. Sounds good, Tim. Thank you.